Hello, my name is Dr. Charles Simone. I'm a medical oncologist, radiation oncologist, and a tumor immunologist. And I also wrote a book called Cancer Nutrition in 1980. This new book, Nutritional Hydration, Medical Strategy for Warriors, will help you, educate you about how to increase your performance both physically and mentally. Nutritional hydration is a term we coined to embody the essence of nutrition and hydration for the body, but specifically for the muscle, the nerve, and the neuromuscular junction. This is a new medical strategy. The chance of success in military operations or competitions is greater if you're mentally and physically fit. Your nutritional status and hydration status before, during, and after competitions or missions is going to greatly influence the outcome, both good or bad. You can be an awesome opponent if you know and are well-trained and well-informed about nutrition and hydration. In fact, you have the advantage over a very complacent leader. This book will actually positively change the lives of both men and women. Fatigue and muscle cramping are a warrior's worst nightmare. Nothing is more frustrating to a highly conditioned athlete than being unable to continue their competition because of fatigue and muscle cramping. Fatigue, cramping, physical exhaustion, and dehydration result from exercise that causes a depletion of vitamins, minerals, amino acids, electrolytes, and many other nutrients. These need to be replaced. If you are dehydrated by as little as 2%, your performance comes down to 85%. Dehydration of as little as 5%, your performance decreases to 70%. Dramatic numbers. When I decided to develop a comprehensive nutritional hydration formulation, I summoned my own personal experiences from going to places like the Grand Canyon, hot deserts, and jungles, and also taking care of cancer patients who 70% have fatigue and 40% die of malnutrition and dehydration. I applied my medical and scientific background to determine the most effective ingredients and nutrients necessary to meet the needs of the muscle, the nerve, and the neuromuscular junction. Other topics in our book include many things. A whole chapter dedicated to the female warrior, very important. The 10-point plan, how exactly what you should be doing from nutrition all the way down to stress modification and training. Tables of food composition, how much protein, how much fat, how much cholesterol there is, how much of these foods you actually need for your body weight. So the book is an all-inclusive program with regard to nutrition, hydration, and what you should be doing yourself. Now, I'd like to introduce Coach John McKenna. He will combine his unique style of using bands and kettlebell training to increase a person's performance, agility, strength, and stamina in a very unique way. Coach?
Hi, I'm Coach John McKenna. I've been a strength coach for over 25 years. Trained at the high school level, trained college athletes, and I've trained several gentlemen who are in the NFL at this point. I'd like to share with you a piece of training that we've picked up, or I've picked up years ago, called kettlebells. Kettlebells are a small piece of equipment that can be used in various different ways. If you listen to the big fancy gyms, they don't want you to hear about kettlebells, because I can get 2 or 3 kettlebells, take you anywhere, a park, your home, your office, and you can train and get just as good a workout as you do at any gym. And you can do it at any time you want. Several reasons why kettlebells are good. Kettlebells give you a full body type workout. That's how you live your life. Full body, moving, changing directions. That's what you need, and that's why I like kettlebells. Kettlebells let you move at different ranges of motion. You can go sideways, you can move around, you're pressing, you're all over the place. Kettlebells will give you total body strength. Kettlebells expose your weaknesses when you first start doing them. Usually what happens, we start doing our kettlebell swings, and you'll find that we've got a lot of trouble with our lower backs, our hamstrings, because they're not strong. So they'll tell you where you need to work on. Kettlebells give you so much variety. I can do every exercise you can imagine with a kettlebell. We can do it one-handed, two-handed. We can move around with it. We can do it bent over. We can do it from the floor, all with 2 or 3 bells. People say you can't combine strength and cardio. That's what kettlebells does. Okay, the first exercise will be the 1 bell, 2-handed swing. The main muscle worked here is the hamstring, calves, shoulders, glutes play a big part. Again, it's a full body exercise. If you notice, Chris is throwing the hips through. It's a violent movement. Now we'll turn around. He'll give us a side view. Watch the hips here. Good explosion down to about a 3/4 squat. A great movement. Chris does this very well. This exercise is a dead clean into a squat into a 1 bell press. Okay, now we've taken 3 exercises. We're taking the squat, combining with the dead clean and the shoulder press, a good military press. Good full body explosive movement. And I keep mentioning full body, but that's how we live. That's how we work. We work full body for athletes. We're normal people. We're in the military. We have to learn to use our full body and have full body strength. Again, we're going to show you our stretching routine in a few minutes. And I'm not telling you that's what I want you to do at the end of every workout. But I do want you to stretch at the end of every workout. The most important thing you can do. If you want to do a movement stretch before your workout or your team structured event, that's fine. But at the end, shame on you if you're not stretching. You're going to prevent injuries. You're going to maintain your muscles. You're going to help your muscles recover. And that's why we stretch at the end of every workout and every practice. And the first thing we're going to show you is we do our ankles first. And a lot of it, just letting the player work. He'll take the band, he'll put it around the top of the toe, and you notice he's just working the ankle. Everybody's built different. I'm built different than Chris. Chris is built different than Ranford. So he knows where his ankle bothers him. So this gives him the opportunity to work it around, see how he's stretching, he's pulling it. Again, this is why we don't have ankle problems, because we work at it. So I'll let these guys do this for a good minute. Then the next exercise we'll do, I'll say, okay, let's go toe front. And all he's going to do is hold that band tight and push the toe forward. We usually do about 15 to 16 reps, and he's always under control when he does this. Next thing we'll do is we want to work the Achilles tendon a little bit on bend the knee, hold the band at the top of the knee, and all we're going to do is push that toe down forward. Okay, now we're going to move to the hamstring, and the first thing we're going to do is we're going to do 8 hamstring pulls. He's going to lay back, keeping his knee straight, nice and easy, with a nice controlled movement. He's going to pull and stretch that hamstring. I don't want to be too slow, because in life we move fast, and we want to get that good stretch. We've got blood flowing in there at the end of a workout. The next movement we'll do is we'll go right into a hamstring pump. Now he'll keep the foot parallel with the sky. He's got the band pulled down tight, and he's pushing that hamstring up. We're going to strengthen a little bit here along with stretching.